Hey, what's up everybody? Welcome back to my channel. My name is Tamisha, the Codepreneur. And on this video today, I'm going to talk about how to get your stubborn patients to do what you're asking them to do, right? This is always a tough topic, especially when you have stubborn patients that don't want to do therapy. They don't want to get out of bed. What do you do? So in this video, I'm going to give you some tips and tricks on what you can do to get your stubborn patient to do everything you're asking them to do. All right, let's go. Hey y'all, so welcome back. All right, so in this video, I want to give you guys some insight on what you can do when you are dealing with a patient that is being stubborn and they are giving you a hard time. Now, of course, there's going to be some reasons why they do not want to work with you, and I'm going to mention that in this video. And there's going to be instances where you just have to just take the loss, right? Sometimes people will stand in their no, and that is it. But what I'm going to provide you is different ways and techniques to be able to try to change their mind in a positive and ethical way. Of course, if someone is having extreme pain, I would not force them to do therapy. The first thing you would do is go let nursing know that this person is having extreme pain. Let the patient know that, okay, I understand your concern. I understand that you're having pain. I'm going to let the nursing know that you're having pain. I will check back with you in about 2 hours after you have your pain medicine, or I'll check back with you in an hour just to see how you're doing and see if we can try to do a little something if you're up to it. Would that be reasonable? Okay, so you can approach it in that way. But before I jump ahead, let me just tell you where you can get this insight. So in my book, in my book, 12 Case Studies, there's a section on page 97 where I break down how to motivate the unmotivated. All right, so in my book on page 97, and it says this, it says, there are factors that must be addressed to find out the underlying causes of poor motivation, lack of interest, failure to thrive, being uncooperative, detached, and all the other terms we therapists use to describe a patient unwilling to participate in the therapy. By analyzing these three compromised areas, emotional health, external factors, and misunderstood rehabilitation expectation, these areas provide a means of approach when dealing with difficult patients. All right? So, this information I literally just read directly from my book. All right. So some tips to remember is you want to get down at their eye level. All right. You don't ever want to stand over someone because that would make them feel like you're being superior. So a lot of times if my patient is lying in bed, I will pull up a chair and I will sit down so I can be eye level with them. All right. You want to speak slowly and calmly. You never want to raise your voice. So if somebody's upset, you don't want to match their energy. You actually want to bring the energy down. So if somebody's really upset and their voice is getting elevated, then I would actually be mindful of how I'm breathing, right? Because a lot of time if you're breathing fast, your chest is moving, someone can see that. But once you start breathing very slowly, it kind of brings your body into a sense of calm. And if I'm just talking very calmly and saying, all right, I'm very sorry you feel this way. Okay, I understand your frustration. Do you see how much more calm that is versus saying, okay, well, you know what I mean? Like, you don't want to match the energy. You want to try to bring that down. And you always want to be mindful of your body language, right? Always come in with a smile on your face, right? If you're coming in with already an attitude, if your demeanor is already off because you're thinking about things that happen outside of work, people are going to pick up on that. All right. So there's more tips in here, but I just want to mention those three for now. So here is what we're going to do. I'm going to go through the first part, which is emotional health. And if you guys want to know more about the external factors and misunderstood rehabilitation expectation, I definitely encourage you to get your hand on my book. All right. So emotional health. So the first one I mentioned is your patient sad? If so, why? All right. So the first thing is you want to listen to your patient attentively. You want to show empathy. Then you want to ask the patient, what can I do to help? All right. Then you're going to provide a solution while explaining how your services and participating in therapy is beneficial. And then you keep your word and make sure you follow through. So sometimes in therapy, it's not all about the physical things that we do. Sometimes your patient just needs an ear, and you can use their therapeutic use of self to support these patients, okay? You need to find out what is the underlying cause for this person being sad and depressed and down and out. And this is definitely a very particular skill you're going to need when you are working in the mental health setting. And it's very important to do active listening. All right. When you do active listening, it allows you to pick up on issues or pick up on the concerns, and then you can address the concerns and you can start peeling it back to really get to the root cause. And by doing that, now you're building trust, you're building connection, and your patients are going to be more willing to work with you because you're saying that I'm taking the time to listen to you. I'm taking the time to understand, and I'm really trying to show you that I'm here to support you and help you. The next one I have in my book here that I mentioned is your patient mad? If so, why? Then I break down how you can help them. Then I go into, is your patient depressed? If so, why? Then I break that down. Is your patient frustrated, right? Does your patient have obsessive compulsive behavior, which affects participation? Then I break that down. Is your patient bored? If so, why? All right. So these are the things that I've mentioned here in my book. I mean, if I go through all of them, we'll be here for a very, very long time. But I just want to let you guys know that you can motivate the unmotivated. One of the little tip I want to leave you guys with that I've used, and it seemed to work for me, is whenever patients don't want to work with me, I always make it seem, in a sense, while still being ethical, the importance of me needing their help as well, and that is a partnership versus I need them to do. All right. So the conversation may go something like, oh, let's say Joe is a patient of mine and he doesn't want to do his therapy today. And I knock and I come in and I'm like, hi, Joe, how are you today? You ready for your therapy? And he's like, oh, Tamisha, I'm just not up to it today. All right. Now, there's nothing wrong with Joe. Joe doesn't have any pain. He's just not in the mood. Okay. What I would normally say is, oh, Joe, I was really looking forward to working with you today. I really have something really awesome for us to work on today because I really want to get you out of this place as soon as possible and get you back to your life, get you back to your family. It would just help me out so much, Joe, if you did work with me today because my day has already started off a little challenging, and just having someone to say, you know what, Tamisha, I will work with you today will really help me out. And I'm hoping you would be that person. So how about we try to do just a little bit? How does that sound? And Joe might say, well, Tamisha, I don't know. I don't really feel like going to the gym today. Then I would probably say, okay, Joe, I totally get it. I tell you what, how about I bring the gym to you? How about we work right here and we do a few things right here in your room where you're most comfortable? And a lot of times, guys, Joe will turn around and be like, oh, Tamisha, you're so persistent. Okay, let's do it. All right. So just using these kind of strategies will help you. And I break those strategies down in my book in more detail. Of course, I don't want to make this video too long, so I'm not going to go through every single strategy. Just definitely go ahead and get your hand on my book. It is down there in the description below. So real quick, guys, I just wanted to jump in to this video real quick and just add on these key elements. I definitely give you guys some hints on how you can help your patients to work with you. But I just want to point this out, that it's very important that you first listen, you understand, you build trust, you address any barriers they may be having, and you also want to explain and reintegrate their why, right? Remind them on the importance of why they're in therapy and what result they want. So if they're in therapy because of an injury, an illness, a disease, the goal is to get them better, the goal is to get them independent, and the goal is to get them back to their lives. So you always want to come with that instead of saying, hey, you got to do your therapy. You know, it's important. You need to do your therapy, do it, right? It's all about the approach. Okay. And don't forget, being flexible is key. And if it still gets to the point where they're really refusing, then yeah, you're going to probably need to get family support. You're probably going to need to get the social worker involved. You're probably going to need to get other people involved to really find out what is the root cause of them completely not wanting to do anything. Now, this is very rare. Most patients will still work with you, but this is mainly for those patients that they're just really suffering from failure to thrive, and they are just completely depressed. They will probably need other intervention other than you. So I hope that this was helpful. So anyway, back to the video. Like this video? Go ahead and share, like, comment, and don't forget to subscribe. Until next time, guys, bye-bye.